New COVID case numbers are beginning to decline, but many hospitals are still in overdrive with patients suffering from the virus. It's been a difficult time for doctors and nurses as they face shortages and this surge.
To give an inside look at the challenges they've faced, UK Healthcare is launching a series of videos with first-hand accounts of healthcare workers. Chad Hedrick explains the voices from the front lines.
For more than 18 months now, these men and women at UK Chandler Hospital have faced COVID-19 head-on.
But COVID is something entirely different. We throw everything we have at it, and we still lose patients anyway.
Day in and day out, the frontline workers are treating patient after patient, watching as many suffer.
In the emergency department, we're used to dealing with large numbers of people. We're used to dealing with a lot of patients coming in. What we are not used to is as sick as so many of them are.
At the onset of the pandemic, the emergency department was seeing as low as 120 patients a day. Now it averages 270. As of Wednesday, the COVID unit has 136 patients. Only 30 are vaccinated and 6 are unvaccinated children. 49 are in the ICU with 34 on a ventilator.
I think people think that it's not going to affect me, it's going to affect somebody else who's older or sicker. But it knows no boundaries.
In a series of videos UK Healthcare will be premiering, they are following frontline workers and highlighting their perspectives, even the traumas of seeing patients on a ventilator and the weight of the circumstances.
I struggled and my husband was like, "Why are you so fixated on this?" And I was like, "Because it's gonna happen again. This is not gonna be the last person who comes in very sick."
They hope these videos can open some eyes, roll up sleeves, and ultimately save lives.
The best thing that anybody can do is help us save you by taking a step to help save yourself. These deaths are preventable.
In Lexington, Chad Hedrick for the Fox 56 10 o'clock news.
UK Healthcare does have resources available for their staff who are struggling to cope with the work and losing patients. During the pandemic, UK Psychiatry launched the REST program, which provides staff with stress reduction and coping skills.